We continue with the back transporting points, bladder 25, the large intestine Shu. Location, bladder 25 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fourth lumbar vertebra. How to find bladder 25? For orientation in the lumbar region, first determine the Taffier's line. Place both hands directly superior or lateral to the highest point of the iliac crest, joining the thumbs on the midline of the lumbar spine. In most cases, this line intersects with the spinous process of L4. Note this varies depending on the patient's position. On this level, locate bladder 25, 1.5 June in a lateral direction. Located on the same level are DO3 on the midline, a point of EXB2, 0.5 June lateral to the midline, EXB6, 3 June lateral to the midline, and EXB7, 3.5 June lateral to the midline. Needling, vertically 1 to 1.5 June. For the actions indications, bladder 25 regulates the intestine and promotes the qi flow. It also strengthens the lower back. For the special features, bladder 25 is the Back-Shu point of the large intestine, important point for regulating the large intestine qi, important local point for acute and chronic lumbar disorders. First of all, bladder 25 point promotes the excreting function of the large intestine and can be used to treat both constipation and diarrhea. For the latter, it is often used in combination with bladder 20. Being the back transporting point, it is specially indicated for any chronic disease of the lumbar of the large intestine. Bladder 25 is also indicated in excess patterns of the large intestine to relieve abdominal fullness and distension. It is also frequently used as a local point for both chronic or acute lower backache. In acute backache, this point is often tender on pressure, and if so, it should be needled with reducing method. Bladder 25 promotes the function of large intestine for those having borborygmy, diarrhea, undigested food in the stools, blood in the stools, difficult bowel evacuation, constipation, prolapse of rectum, abdominal distension and pain, hypogastric pain, umbilical pain. It also strengthens the lower back, those having lower backache, stiffness of the lower back, painful obstruction syndrome, the B syndrome of the legs. Bladder 25 is the Back-Shu point of the large intestine, where the qi of the large intestine emanates from the interior of the body surface. It is an important point to regulate the function of the large intestine Fu, and its application is very broad. When the spleen is deficient or suffers from dampness, there may be loose stools, diarrhea, undigested food in the stool, blood in the stool, borborygmus, and inability to gain weight despite eating copiously. In combination with points that tonify the spleen and stomach, bladder 25 is an important point to firm and tonify the intestine. When there is stagnation of qi, blood, damp heat, toxic heat in the intestinal region, there will be distension, pain, cutting pain, fullness, constipation, intestinal abscess. In combination with other suitable points, bladder 25 is able to regulate qi and dissipate stagnation. When the central qi is deficient or when damp heat sinks downward, there may be prolapse of the rectum. Bladder 25 is a valuable adjacent point used in the treatment of this disorder. In combination with points such as DO20 and DO1, as well as points which treat the underlying disharmony. Finally, bladder 25 is an important local point in the treatment of lumbar pain, and like many points of the lower lumbar region, is also indicated for painful obstruction and atrophy disorder of the lower limbs.